Ebola is a virus that causes the disease Ebola hemorrhagic fever. The actual Ebola virus is caused by filoviridae Ebola virus, which has 4 subtypes. The only subtype that actually affects humans is Ebola restin. This subtype is a systemic virus. This type of virus attacks all the organs and tissues of the body besides the skeletal system. The first thing the virus does is weaken the immune system, and then it basically digests the tissue that holds the organs in place. Blood clots form, and blood begins to leak from openings on the body, such as the eyes, nostrils, ears, mouth, rectum, and cuts on the body. Scientists do not know much about the Ebola virus. They do not know its natural host or its mechanism for survival in nature. That is why doctors do not know how animals or humans first contract the disease. They do believe, though, that it is an animal-borne disease that arose from animals with African origins. It can be passed from animal to human or from human to human through direct contact with the blood or secretions of an infected organism. The virus can also be passed through contact with infected objects. This commonly occurs with the reuse of needles. There are many symptoms that arise from Ebola. The common symptoms include fever, headache, joint and muscle pains, sore throat, vomiting and stomach pain, rash, and also internal and external bleeding. Diagnosing the disease is difficult though, because there are many diseases with the same symptoms. If a person does contract the Ebola virus, there is little the doctors can do. At the moment, there is no cure for Ebola. Blood transfusions can help due to the large amounts of blood lost, but death is typically always the end result. Death normally occurs within a month and can occur from blood loss, shock, or renal failure. There have been some survivors, but doctors do not understand why some patients survive and others don't. The only way to be safe is by taking precautionary measures. A few include avoiding outbreak areas, washing hands, avoiding infected animals and people, never reusing needles, and avoiding meats in developing countries since it is an animal-borne disease. Unfortunately, doctors have not found a working vaccine either, so it is vital to follow these precautionary measures to avoid contracting the disease.